Hey guys, so in today's video, I'm going to be talking about 3 improvements I would make to a nursing undergraduate program. Leo here is going to help me. Let's get started. Before I begin, please consider subscribing down below. I'll be uploading a new video every single week. So the first improvement I would make to my nursing undergraduate program would be to improve and enhance the clinical experiences. I think the clinical experiences were great, but they could be a lot better. The quality needs to be more student-centered. It needs to range from different experiences based on what the student wants. If I want to work in acute care, I don't really want to do a maternity rotation. I don't want to do a mental health rotation. I want to focus on what I want to do as a nurse when I graduate. If that's my interest, they should provide me more exposure into what I really want to do. So the first change I would make is to make the nursing undergraduate clinical experience more individualized to the person themselves, rather than giving them a whole bunch of general information, general experiences, and expect them to like it. So the second improvement I would recommend to nursing undergraduate programs is to increase the amount of clinical experience and clinical hours required for a student to graduate. The reason why I would do this is because I feel like there should be a lot more emphasis on what you actually do as a nurse rather than teaching you educational content. While I think educational content is important, I think there's a huge gap between what you learn in class and what you do in the clinical setting, and most of the time you're going to get a job in the clinical setting. So as a result, I feel like there's a huge knowledge deficit, and I feel like there could be huge improvements in this field from the nursing undergraduate programs. So the third improvement that I would recommend all nursing undergraduate programs to do is to have more relevant educational content. The educational content was very basic. At least in my program, it talked about, the basic heart, liver, respiratory, digestive system, all these general concepts, and it didn't really delve into deep topics and common diagnoses that you see in a hospital setting. And I understand it can be difficult to provide the specific details, but it was just such a huge gap between what they taught us in lecture and what you actually saw in the clinical setting. And so I feel like they need to have it more specialized, in that they should identify areas where nurses actually need to know. Like, for example, emphasize lab values and how it relates to different GI disorders that you see in the hospital. So for example, a lot of times you see a patient with a GI bleed or black stool, for example, and one lab value that's critical for that is hemoglobin. And although they talk about it briefly, they don't really draw a connection and provide emphasis on the hemoglobin, for instance, in this case. But in the actual real life nursing setting, you see that hemoglobin is a huge factor and that you're always monitoring it, especially when someone is admitted for a GI bleed. So that's the end of this video, guys. Those are 3 improvements that I would make to my nursing undergraduate program, and I'm sure all nursing undergraduate programs are the same. If you thought this video was interesting, please give it a thumbs up, and I'll catch you guys in the next video.